So let's talk about emergency medications. These are medications that are used to meet the immediate therapeutic needs of patients. So they are used in critical or life-threatening conditions such as cardiac arrest, shock, etc. I have here 40 common ones that we should have in our crash cart. So we'll look at their uses, the route of administration, and the dose. But before we do that, let's look at a few abbreviations used in this video and their meaning. You can pause the video and have a look at them. The first on my list is oxygen. So oxygen is used in respiratory distress, hypoxemia, cardiac and respiratory arrest, and for the maintenance of oxygenation during anesthesia and other procedures such as suctioning. It can be delivered with a low flow or high flow system. So for the low flow, we have nasal cannula, simple face masks, non-rebreather masks, and venturi masks. And for the high flow, we have continuous positive airway pressure, which is CPAP, bi-level positive airway pressure, which is BiPAP, bag mask devices, and ventilator. The delivery device used is based on oxygen requirements and also the flow rate. So the dose is usually 2 to 15 liters per minute depending on the severity of hypoxemia. Adrenaline is also known as epinephrine. It's an alpha beta agonist. So it works by causing smooth muscle contraction and vasoconstriction. So the route of administration is IV or IM depending on the indication. It's used in cardiac arrest, in allergic reactions, and also to arrest superficial bleeding. So it comes in 1 milligram per mil. Okay, so for CPR, we are usually given 1 milligram every 3 to 5 minutes. The recommended concentration is 1 in 10,000. In order for us to get that, we are going to dilute the 1 mil in 9 mils of normal saline. Regular insulin. So it's sold under the brand name Humulin R, Novolin R, etc. It's an anti-diabetic. So it works by promoting the uptake of glucose from the blood so it can be used or stored by the body. The route of administration is IV, IM, or subcut. It's used for the treatment of hyperglycemia, that is high blood sugars. The dose for severe hyperglycemia is a continuous IV infusion of zero point 0.1 units per kilograms per hour. It's also one of the medications in the hyperkalemia cocktail treatment. So we give it IV 5 to 10 units with 50 ml of 50% dextrose. Dextrose. So the name varies based on the percentage of dextrose in the solution. For instance, we have 50% dextrose, 5% dextrose, etc. So it's a glucose elevating agent and the route of administration is IV. It's used in the management of hypoglycemia. So we have a variety of concentrations from 2.5% to 70% dextrose. For the management of severe hypoglycemia, which is blood sugar levels of 3.9 and below, we usually give 50 ml of the 50% dextrose or 40 to 100 ml of the 25% dextrose. Furosemide is sold under the brand name Lasers. So it works by inhibiting the reabsorption of sodium and chloride at the proximal and distal tubules and also at the loop of Henle. The route of administration for the injection form is IV. It's used in the management of edema associated with congestive cardiac failure, liver cirrhosis, renal disease, etc. It's also used in acute pulmonary edema, hypertension, and in ACLS is used in hyperkalemia treatment and also hypermagnesemia. So the dose for acute pulmonary edema is IV 0.5 to 1 milligram per kg or usually 40 milligram over 1 to 2 minutes. And the IV dose should not exceed 200 milligram per dose. Mannitol is sold under the brand name Osmitrol. It's an osmotic diuretic that works by increasing the osmolarity of plasma, which will result in an increased flow of fluid from tissues such as edematous brain tissue into the blood. and then is further excreted from the blood via the kidneys as urine. So the route of administration is IV infusion only. It's used in the reduction of increased intracranial pressure associated with cerebral edema and also in the reduction of elevated intraocular pressure. So it comes in 100 grams per the 500 mils bag. For increased intracranial pressure, the dose is 0.25 to 2 grams per kilo over 30 to 60 minutes. And it's recommended to use a filter type set to administer concentrations that are greater or equal to 20%. This is to ensure that you are not infusing mannitol crystals. Magnesium sulfate. So it can also be written in its chemical form, and sometimes verbally we call it MagSolv. It's an electrolyte, an antiarrhythmic, and the route of administration is IV or IM. So it's used in the treatment of hypomagnesemia, that is low levels of magnesium in the blood, and also to prevent seizures in preeclampsia or control seizures in eclampsia. In ACLS, is used for the management of torsade points. For the management of seizures in eclampsia, you give an initial dose of 4 to 5 grams in 250 ml of 5% dextrose or normal saline. And then you can give 1 to 2 grams per hour every 4 hours when necessary. So for cardiac arrest caused by torsade point, you give 1 to 2 grams diluted in 10 ml of 5% dextrose over 5 to 20 minutes. Potassium chloride. So it can also be referred to by its chemical name, that's KCl. It's an electrolyte and the route of administration is IV infusion only. It's used in the treatment of hypokalemia or the prevention of it. So the dose usually depends on the severity of hypokalemia. Usually we are giving less than or equal to 40 millimole over 4 or more hours. You have to dilute it in 500 ml to 1 liter of compatible fluid. And the rate shouldn't exceed 10 millimole per hour. So KCl is one of the medications you should never give as an IV push, but IV infusion. I have a video on medications you should never give as an IV push. The link to the video is in the description. You can watch it to know the mils of diluents to use for the various doses of KCl. Calcium gluconate. So the route of administration is IV only and is used in the treatment of hypocalcemia and also used to stabilize the heart during the hyperkalemia treatment. It's used as an antidote for calcium channel blocker overdose and also for the treatment of hypermagnesemia. The dose for the hyperkalemia treatment is 1 to 5 to 3 grams infused over 2 to 5 minutes. Sodium bicarbonate. It's an alkalinizing agent and the route of administration is IV. So it's used in the treatment of metabolic acidosis and cardiac arrest that is caused by metabolic acidosis. It's also used for the correction of hyperkalemia. So for severe metabolic acidosis, the dose is 90 to 180 milliequivalents per liter at a rate of 1 to 1.5 liters per minute in the first hour. And for cardiac arrest, the dose is 1 milliequivalent per kg as a start dose, and the subsequent doses should be based on the results of ABGs. Salbutamol. So it's sold under the brand name albuterol or Ventolin. It's a bronchodilator, a beta-2 agonist. So it works by relaxing the airway smooth muscles in order to enhance ventilation. The route of administration is inhalation. It's used to relieve bronchospasms, shortness of breath in asthmatic patients, and also patients with chronic obstructive pulmonary disease. The dose for acute or severe bronchospasms is 2.5 to 5 mg every 20 minutes for 3 doses. Ipratropium bromide. So it's sold under the brand name Atrovent. It's a bronchodilator, a short-acting anticholinergic. So the route of administration is inhalation. So it's used to relieve bronchospasms and also shortness of breath in people with COPD, and also used for the management of acute asthma exacerbation. So the dose for chronic obstructive pulmonary disease is 500 micrograms every 6 to 8 hours. And for acute asthma exacerbation, we usually give 500 mcg every 20 minutes for 3 doses. Hydrocortisone. So it's also known as alkene sprinkle. It's a corticosteroid. So it works to reduce inflammation in the body by suppressing the immune response. And the route is IV or IM. It's used to treat inflammation such as status asthmaticus and also in an anaphylactic reaction. The dose for status asthmaticus is 1 to 2 milligram per kilograms every 6 hours for the first 2 hours. Dexamethasone. So it's sold under the brand name Decadron DSC. It's a corticosteroid, and the route of administration for the injection is IV or IM. So it's used for the treatment of inflammation such as cerebral edema, allergic conditions such as atopic dermatitis, asthma, and shock. The dose for cerebral edema is usually 10 milligram bolus and then 4 milligram every 6 hours. Phenytoin, it's sold under the brand name Dilantin. It's an anticonvulsant used to control or prevent certain types of seizures, such as tonic-clonic seizures, and the route of administration is IV or IM. It's used to treat or prevent certain types of seizures, such as tonic-clonic seizures, status epilepticus, and focal seizures. The dose for status epilepticus is a loading dose of 10 to 15 milligram per kg at a rate of 50 milligram per minute, and then you can give 100 milligram every 6 to 8 hours. Diazepam, sold under the brand name Valium. So it's a benzodiazepine, an anxiolytic, an anticonvulsant, a muscle relaxant, and the route of administration is IV or IM. It's used to treat seizures, cause sedation, and also to relieve muscle spasms. The dose for status epilepticus is IV, 5 to 10 milligrams stat, and you can repeat this dose at a 10 to 15 minute interval if necessary, up to a maximum dose of 30 milligram. Midazolam, sold under the brand name Caesalam, is a benzodiazepine which exerts sedative, anxiolytic, and anterograde amnestic effects. Okay, so the route of administration is IV or IM. So it's used for procedural sedation, seizures induced by organophosphorus poison, and also status epilepticus. The dose for sedation of intubated patients is 0.5 to 4 milligram over 2 minutes up to a maximum dose of 3 milligrams. Succinylcholine, also known as saxmethomium or sometimes shortened as sax, is a neuromuscular blocker. So it works by causing short-term muscle paralysis in order to facilitate procedures such as tracheal intubation. The route of administration is IV or IM. So sax is one of the medications that you should use with caution because death due to errors has been reported, and especially in patients for whom the medication was not even intended for. Okay. Also, there are notable side effects such as hyperkalemia, malignant hyperthermia, etc., that you are supposed to pay attention to whilst administering this medication. So it's used for muscle relaxation to help facilitate procedures such as emergency intubation, aid in mechanical ventilation, and other surgical procedures. So the dose for short procedures is IV, 0.6 to 1 milligram per kg. Atropine is sold under the brand name Atropine. It's an anticholinergic, and the route of administration is IV, IM, or subcut. It's used for the treatment of sinus bradycardia and also as an anesthetic pre-medication to dry up secretions. Okay. Also, it's used as an antidote for organophosphate poisoning. So the dose for sinus bradycardia in ACLS is IV 0.5 to 1 milligram or 0.04 milligram per kg every 5 minutes and not more than 3 milligrams. Amiodarone is sold under the brand name Passeron. It's an antiarrhythmic agent and the injection route is IV. So it's used to treat ventricular arrhythmias when there is no initial response to defibrillation. It's used to treat pulseless ventricular fibrillation and also ventricular tachycardia. The dose in ACLS is IV 300 milligram and you give it as a rapid IV push if there is no pulse or BP, and then you follow with 150 milligram every 3 to 5 minutes. Lidocaine is sold under the brand name Xylocaine. It's a local anesthetic agent that works by blocking the pain signals and numbing the site of procedure. It's also an antiarrhythmic agent that helps to terminate ventricular arrhythmias which have not responded to initial defibrillation. It's given IV or percutaneously. In ACLS, it's used in cardiac arrest where there's ventricular fibrillation or ventricular tachycardia as a second-line antiarrhythmic agent. It's also used as a local anesthetic agent for minor procedures such as suturing or making an incision. In ACLS, the dose is IV 1 to 1.5 milligram per kg over 2 to 3 minutes. There also has to be continuous ECG monitoring in order for us to detect decreasing cardiac conductivity so we can intervene by stopping the medication. Adenosine is sold under the brand name Adenocard. It's an antiarrhythmic agent that works by slowing cardiac conduction in the AV node. The route of administration is IV. It's used in the conversion of paroxysmal supraventricular tachycardia to sinus rhythm or normal rhythm. The IV dose is 6 milligram as a rapid IV push over 1 to 3 seconds. So you have to push it as fast as you can and then you follow with a rapid flash of 20 ml of normal saline. If there's no conversion within 1 to 2 minutes, you go on to give 12 milligrams, but you're not supposed to exceed a total dose of 30 milligrams. So I have a detailed video on adenosine administration that you should check out. Digoxin is sold under the brand name Lanosin. It's an antiarrhythmic agent and also an inotrope. So as an inotrope, it works by increasing the force of contraction of the heart. It also decreases the heart rate. So for this reason, before you administer digoxin to any patient, make sure you check the heart rate. If it's less than 60 beats per minute, you do not administer. So the route of administration is IV or IM, but it's recommended to avoid the IM injection as it causes severe injection site reaction. It's used in the management of atrial arrhythmias such as AFib, atrial flutter, and atrial tachycardia. It's also used to manage heart failure. So the dose for atrial fibrillation is a loading dose of 8 to 12 micrograms per kg as a slow IV, then a maintenance dose of 0.1 to 0.4 milligram per day. For heart failure too, that's the dose. Metoprolol is sold under the brand name Lopersa. It's a beta blocker and the route of administration is IV. So it's used in acute myocardial infarction, acute tachyarrhythmias, and also atrial fibrillation or flutter. The dose for acute tachyarrhythmias is IV 5 milligram as a rapid IV push over 1 to 2 minutes, and then you can give it every 5 minutes, but the total dose should not exceed 15 milligrams. Morphine, sold under the brand name MS Contin, is an opioid analgesic that can be given IV, IM, subcut, or intrathecal. So it's used to manage acute pain such as myocardial infarction. So another reason why it's the analgesic of choice in MI is because it decreases the heart rate, BP, and venous return, which can consequently decrease the myocardial oxygen demand. It's also used to manage chronic pain. The dose is 2 to 10 milligram per 70 kg body weight. Ephedrine is sold under the brand name Emifed. It's an alpha beta adrenergic agonist and the route of administration is IV. So it's used for the treatment of clinically significant hypotension induced by anesthesia perioperatively and also to relieve allergic reactions. The dose is an initial dose of 5 to 10 milligram IV bolus. You're not supposed to exceed a dose of 50 milligram. It comes in a concentration of 50 milligram per ml. So in order for you to get your desired dose, you have to dilute 1 ml of the 50 milligram per ml with 9 ml of normal saline or 5% dextrose to yield a concentration of 5 milligram per ml. Dopamine is sold under the brand name Intropin. It's an inotrope that works by causing vasoconstriction and increasing cardiac contractility with a resultant increase in cardiac output. So the route of administration is IV infusion. It's used to treat hypotension and low cardiac output. It's also used to increase the mean arterial pressure in septic shock patients. The dose is 5 to 50 micrograms per kg per minute, and the 200 milligram dose should be diluted in 250 ml of compatible solution, such as normal saline, 5% dextrose, or Ringer's lactate. Dobutamine. It's an inotrope, and the route of administration is IV infusion. It's used in the treatment of low cardiac output and also cardiac decompensation. The dose is IV 2 to 20 micrograms per kg per minute, and the 250 milligram dose should be diluted in 250 ml of compatible fluid such as 5% dextrose, Ringer's lactate, or normal saline. Noradrenaline is also known as norepinephrine. So it's an alpha beta adrenergic agonist which works by causing peripheral vasoconstriction. This increases the systemic vascular resistance, causing an increase in cardiac output and an increase in heart rate. The route of administration is IV infusion only. So it's used in the treatment of acute hypotension, also in cardiac arrest and septic shock that is not responding to fluid resuscitation. The dose is 8 to 12 micrograms per kg per minute, and you're supposed to dilute the 4 milligram in 1 liter 5% dextrose to have a concentration of 4 micrograms per ml. Dilute in dextrose solution only. Labetalol. So it's sold under the brand name Trandate. It's a short-acting beta blocker that works by causing vasodilation and decreasing the heart rate. The route of administration is IV only. So it's used in the management of hypertensive emergencies and urgencies. So systolic BP is greater than 180 millimeters of mercury and diastolic greater than 120 millimeters of mercury. The dose is 20 milligram over 2 minutes, then 40 to 80 milligram every 10 minutes. You are not supposed to exceed a total dose of 300 milligrams. The administration is also supposed to be in conjunction with BP monitoring every 10 to 15 minutes. Naloxone is sold under the brand name Narcan. It's an opioid antagonist that works by attaching to opioid receptors and reversing its effects. It restores normal breathing to someone with respiratory depression or cessation due to opioid overdose. So it's given IV, IM, or subcut. There's also the intranasal form. So it's used for opioid overdose reversal and also for the reversal of respiratory depression with therapeutic dose. The dose is 0.4 to 2 milligram. Then every 2 to 3 minutes you can repeat if necessary, but you're not supposed to exceed a total dose of 10 milligrams. So if you give 10 milligrams and there is no reversal, then other causes of respiratory depression should be considered. To administer as an IV infusion, you're supposed to dilute to a concentration of 4 micrograms per ml. So, for instance, if you're giving a dose of 1 milligram, you're going to dilute it with 250 ml of normal saline or 5% dextrose in order to get that concentration. Flumazenil is sold under the brand name Romazicon. It's a benzodiazepine antidote and it's given IV, IM, or subcut. So it's used for the reversal of benzodiazepine overdose and also the reversal of intentional sedation. The dose is zero point 0.2 milligram over 15 to 30 seconds. You're not supposed to exceed a cumulative dose of 3 milligrams per hour. Heparin is an anticoagulant that works by preventing the formation of clots and also the extension of existing ones. So it's given IV or subcut. It's used for deep vein thrombosis and pulmonary embolism prophylaxis and treatment. Also used in acute coronary syndrome, for anticoagulation, and for catheter patency. For DVT treatment, the dose is 80 units per kilograms as a bolus, then a continuous infusion of 18 units per kg per hour. And then for prophylaxis, we are usually giving 5,000 units every 8 to 12 hours. To maintain catheter patency, you are supposed to instill enough volume to fill the entire lumen of the catheter with a concentration of 100 units per ml. Tranexamic acid is sold under the brand name cyclocapron. It's an antifibrinolytic agent that works by blocking the breakdown of clots in order to prevent bleeding. The route of administration is IV only. It's used to control bleeding such as postpartum hemorrhage, trauma, excessive menstrual bleeding, etc. For acute cases, a loading dose of 1 milligram at a rate of not more than 100 milligram per minute is given. Then a continuous IV infusion of 1 gram in 100 ml of compatible fluid at a rate of 50 milligram per minute. Metoclopramide is sold under the brand name Reglan. It's an antiemetic and the route of administration is IV or IM. It's used in managing nausea and vomiting and also for managing headache. The dose is 10 milligram over 1 to 2 minutes. Haloperidol is sold under the brand name Haldol. It's an antipsychotic and it can be given IV or IM. It's used to manage acute agitation in schizophrenia and psychosis, and also for the management of ICU delirium. The dose is 2 to 10 milligram depending on the degree of agitation. Ketamine is sold under the brand name Ketela. It's an anesthetic agent and it can be given intramuscularly or intravenously. So it's used for anesthetic induction during procedures. A loading dose of 1 to 4.5 milligram per kg is given over at least 1 minute, and for the 100 milligram per ml, you should not give it undiluted. Nitroglycerin. It's also known as glycerol trinitrate, GTN, Neutrostat, Neutroquick, etc. So it's a nitrate and also an anti-angina. It works by causing vasodilation and increased blood supply to the heart while reducing the heart's workload. So it can be given sublingual or IV. So it's used for the acute relief from angina, acute coronary syndrome, and then also hypertensive emergency. For the management of acute angina, a sublingual dose of 0.3 to 0.6 milligram is given every 5 minutes. And for the spray, you can give 1 to 2 puffs every 3 to 5 minutes. For IV, a starting dose of 5 micrograms per minute is given, and you have to dilute this dose in normal saline or 5% dextrose. So for the dilution, you dilute the 50 milligram dose in 250 or 500 mils of 5% dextrose or normal saline to have a concentration of 200 micrograms per mil or 100 micrograms per mil respectively. It's important to note that GTN is contraindicated in people taking phosphodiesterase 5 inhibitors such as sildenafil, sold under the brand name Viagra. So these drugs are used to treat erectile dysfunction and pulmonary arterial hypertension. When these medications are given together with GTN, they potentiate the hypotensive effect of GTN, leading to dangerously low BPs. So before you give someone GTN, ask them whether they've recently taken any of these medications or whether they are on it. Aspirin is sold under the brand name Kettler. It's an antiplatelet and also an NSAID. The route of administration is oral. It's used in the management of acute coronary syndrome, ischemic stroke, and transient ischemic attack, and also for the relief of pain and fever. The dose for ACS and STEMI is 325 milligrams start within minutes of symptom. It's the same for ischemic stroke, but it should be given within 24 to 48 hours after a stroke. Clopidogrel is sold under the brand name Plavix. It's an antiplatelet and the route of administration is oral. It's used for the management of acute coronary syndrome and ischemic stroke. So the dose for ACS and NSTEMI is a loading dose of 300 milligrams start. Okay, thank you for watching this video. See you in the next video. Bye.